Okay, now we discuss about the diseases of nerves and muscle, and it is our 10th class. First question is trigeminal neuralgia or tic doulorex is characterized by the sharp excruciating pain of short duration. Next question is Trotter syndrome involves nasopharynx. Horner syndrome include ptosis, flushing and hydrosis. Next question. All of the following are true about trigeminal neuralgia. That includes it is unilateral, it is triggered by touching cheeks or mucosa, it occurs in bouts. Next, Frei's syndrome results from the surgery of the parotid gland. Geniculate neuralgia is caused in the nerve 7. Easy fatigability of the muscles is seen in myasthenia gravis. If a patient with Raynaud's disease puts his hand in cold water, the hand appears as white. A neuralgia with trigger zones in the oropharynx and pain in the ear, pharynx, nasopharynx, tonsils and posterior tongue is most likely sphenopalatine neuralgia. Next, which of the following structures are associated with Bell's palsy? 7th cranial nerve. Facial pain due to elongated styloid process is called as Eagle syndrome. These all are important questions. Next, facial paralysis is tested by whistling. Which syndrome consists of flushing, warmness and perspiration over the cheek and pin of the ear on the side of following ingestion of highly seasoned food? That is auriculotemporal. Once again the question is which syndrome consists of flushing, warmness and perspiration over the cheek and pin of the ear on the side of following ingestion of highly seasoned food? That is auriculotemporal. Next, the latest drug of choice in the management of trigeminal neuralgia is carbamazepine. Carbamazepine has been utilized to successfully diminish attacks in trigeminal neuralgia. During this therapy, which of the following is indicated? That is clinical observation and complete blood and platelet counts prior to and at frequent intervals during therapy. Patient suffering from Eagle syndrome complains of dysphagia. Trigeminal neuralgia does not disturb the patient during sleep. Severe pain which arises after injury or to sectioning of a peripheral sensory nerve is called as causalgia. The following site is a common involvement in case of myositis ossificans. It is masseter. Fothergill's disease is one of the synonyms of trigeminal neuralgia. Bell's palsy is triggered by exposure to cold, tooth extraction, local and systemic infection. Lesion of the facial nerve at the level of stylomastoid foramen leads to paralysis of orbicularis oculi muscle. A patient shows inability to close the right corner of the mouth is most probably suffering from Bell's palsy. What is non-characteristic of Eagle syndrome? Excessive lacrimation. Mask-like appearance of the face with a narrowing of the aperture and rigidity of the mucosa is characteristic of progressive systemic sclerosis. Once again, mask-like appearance of the face with a narrowing of the aperture and rigidity of the mucosa is characteristic of progressive systemic sclerosis. Which of the following drugs is not effective in case of trigeminal neuralgia? Acetaminophen. Next, in an acute attack of migraine, the drug of choice is ergotamine tartrate. Ergotamine tartrate. Next, patient comes with a pain in the pharyngeal region and is having carcinoma of the pharynx. The diagnosis is Trotter syndrome. Burning mouth syndrome describes pain associated with no detectable oral disease. Anticonvulsants frequently used in the management of trigeminal neuralgia are phenytoin, gabapentin, baclofen. An attack of the cluster, a headache, can be aborted by breathing oxygen. TENS therapy is useful in MPDS. Okay. Next, Bell's palsy is characterized by inability to whistle. Which one of the following is seen in facial palsy? Loss of taste sensation in the anterior two-thirds of the tongue. The characteristic alarm clock headache is a feature of sphenopalatine neuralgia. Which of the following orofacial pain is not associated with vascular origin? Anesthesia dolorosa. For myositis ossificans, main cause is trauma. Paroxysmal lacrimation during mastication occurs due to the damage to facial nerve. Next, features of trigeminal neuralgia do not include paresthesia.